Today's video is a set of exercises that would be the progression beyond the initial 8, or it could be where your therapist is starting you because he thought that you had the neuromotor control and the understanding and the fitness to start at this level. With the initial 8, there was a contraction of one muscle group at a time, relaxation of the same muscle group. But the way the body functions, you need to have a coordinated action between muscles on all sides of the joint. There are these synergies that need to work from the posterior muscles to the anterior muscles, from the medial muscles to the lateral muscles, internal rotators, external rotators. Your body functions as a unit, and it's very important that we re-coordinate that system if we are trying to build fitness, move into more challenging exercises, or when you recover from an injury. There is terrific evidence that shows that when you have musculoskeletal pain, then the map of your body on your brain, called the homunculus, gets blurred in that area where you have the discomfort, and so your body sense or your proprioception is thrown off, and everyone has changes in the coordination in their muscles in the area. So it's not good enough to treat the soft tissue changes or put out the inflammation if you are not re-coordinating the muscles to have optimal neuromotor function. You really haven't done your complete rehab, and you're going to leave yourself vulnerable for more injuries to come. It is reasonable to assume that the basis of arthritis in our joints is poor control of the neuromotor system. If there is poor control in the muscles that surround the joint will shimmy during movement, and that shimmy causes wear and tear on the joint structures and will lead to arthritis in the end. We have been pleasantly surprised at how bad someone's x-ray can look, but how well they can function when the neuromotor control is optimal and the muscles can control the axis of motion and stabilize the joint during function. So whether you are trying to enhance your performance, whether you're trying to inhibit the aging process, slow down arthritis from occurring, or whether you're trying to become as functional and comfortable as possible with the arthritis that you have, retraining with this rhythmic stabilization exercise concept could be critical. You'll notice that we are going to have the patient in the same setup that we had for the initial 8, non-weight bearing, stable, joint structures and nerves in a slackened position, so the chances of any harm occurring is very small. The patient or the client will have total control over how vigorous the exercise is, how much force they generate, how many times they repeat it. Remember that the thought is coordination and body sense more than strength and endurance in the beginning. You can work into terrific strength and endurance, but it's really about control, body sense, coordination between the muscle groups. So we're going to start out. She's got her head in a good position. She's got her body stable on the table, knees and hips flexed, so everything is slackened. She will hold the stick, and when you picture someone in a loose pack position, it'll be the same position you see an astronaut floating in space or someone floating in a pool. So if you don't know quite the position you should get into, just picture those and mimic it. Everything is in the slackened position. So she will start out just eliciting contraction of the extremity muscles that will irradiate into the trunk, but no purposeful spine movement in the beginning to be as safe as possible. She will grip the stick and start to compress the stick together. She will take inventory. She'll feel, is there equal action on both sides? Is there any muscle group that is inhibited or is sandbagging, and can she wake it up? Can she call it into action? She will feel the relaxation, and then she will grip the stick and start to stretch the stick apart. She'll take inventory. Are all the grip muscles, shoulder abductors, external rotators, muscles between her shoulder blades, up into her neck, are they kicking in to some degree, and is it equal both sides? She will feel the relaxation. When she gets to the bottom of the relaxation, she won't really pause. She'll start to grip the stick and start to squeeze the stick together. She'll take inventory. She'll enjoy the moment. She'll feel the relaxation. When she gets to the bottom, she'll grip the stick. She'll start to stretch the stick apart. She'll feel the opposite muscles work. Rhythmic stabilization. So there's not a large rest in between. There is a coordinated relaxation of one muscle group, contraction of the next muscle group, relaxation of the second muscle group, contraction of the first muscle group. There's going to be this coordination that's going to build stability, body sense and control, build the base that you need in order to have a better life. As she progresses, then she will try to get her spinal muscles involved. So we'll be conservative in the beginning. When she grips a stick and compresses it together, she'll be stimulating the muscles on the front of her body, so she's going to add the front of her neck. She's going to look down towards her chest and her belly, and she could do that with little or no movement of her neck. So if her neck is arthritic or fragile, she can stimulate the deep neck flexors without there being movement. She'll take inventory, she'll feel the relaxation. When she grips the stick and starts to stretch the stick apart to stimulate the posterior muscles, the muscles on the back, in between the shoulder blades, she'll look up over her eyes, her eyebrows, and that will stimulate the neck extensors. So even if there's not active movement in the neck, there'll be some action, some call to action in those posterior muscles. She will feel the muscles, then she'll feel the relaxation. She will switch. She will feel the relaxation, she will switch, and she will build a base of control, of body sense, of coordination between the muscle groups. As she progresses, when she contracts the muscles in the front of her, then she will actively tilt the chin down, add more muscle contraction of the deep neck flexors. When she stretches the stick apart, she will poke her chin up in the air to ensure that she's getting upper cervical, leading the way to stimulate the muscles on the back of the neck into the thoracic cage. As the exercises progress, as she grips the stick, compresses the stick together, then she will tuck her chin down and de-weight her head 50% off of the pillow. 50% off the pillow? No, that's way off. That's 100%. That's 100%. That's 100%. 100%. 50% off the pillow, so she hasn't accepted all the weight of her head yet. When she lets it relax, she relaxes. And then when she stretches the stick, she will now look up and press her head and neck into the pillow some to really stimulate those posterior muscles more. As she progresses and she can keep the chin tuck as she compresses the stick together, then she'll be allowed to start doing a partial sit-up. It is critical that she can keep the chin tucked as she does the sit-up, because the weakness for the deep neck flexors will show when the chin comes away from the neck. If she can capture that, stimulate those deep neck flexors, the neck will be stable, it will be protected as she does the exercise. As she stretches the stick, again, she can look up as much as seems safe for her joint structures and press her head in the pillow as much as she needs, so she can choose the level of exercise that is appropriate for her, and she can tell you it is a significant amount of exercise when it is done well.